Good afternoon. Welcome to the daily briefing at the St. Clair County EMA. It's Sunday afternoon, and we're joined here once again with our good friend Sam Bierman from the Health Department with some numbers, and Chairman Kern. And today we're going to be doing the question and answers.
We are. So before we get to the question and answers, I'm going to update you with the numbers that we have done daily. And as we have done in days past, the numbers that I give you for St. Clair County are St. Clair County residents that have been tested. As of today, we are at 1,233 that have been tested. We are at 287 positive test results, which is an increase of 11 from yesterday. And that includes both males and females from the age range of 30 all the way up to 80s. We are at 879 negative test results, 67 test results still pending, and I'm happy to report that we are have had no additional deaths, and so we are still at 18 for that. For state totals, we are at 143,318 that have been tested, 30,357 that are positive test results, which is an increase of 1,197 from yesterday. And we are at 1,290 deaths, which is an increase of 31 from yesterday. And our condolences go out to the families that have lost loved ones to this virus, as well as to the medical care providers that have taken care of them. The hospitalization numbers that we are now bringing to you are numbers of those that are hospitalized currently within St. Clair County hospitals. And that is 71 patients are admitted for COVID-related reasons, and 5 patients are on ventilators. And we are bringing you a new set of numbers today. Long-term care centers in St. Clair County that are in outbreak status, and that includes residents and staff members with 2 or more at a single facility. And those are as follows. Brea of Belleville has 11 positive cases and 1 death. Colonnade of O'Fallon has 2 positive cases and no deaths. Four Fountains has 8 positive cases and 1 death. And Memorial Care Center of Belleville has 13 positive cases and 1 death. And now I will turn it over to Chairman Kern for his update.
Thank you, Sam. So the zip code report today is 62201. There are 8. 62203. There are 10 COVID positive cases. 62204. There are 9. 62205. There are 9. That is an increase of 1 over yesterday. 62206, there are 22. 62207, there are 15. That is an increase of 1 over yesterday. 62208, there are 19. 62220, there are 18, and that is an increase of 2. 62221 remains static at 28. 62223 have 20. 62226, there are 42. That is an increase of 2. 62258 remains at 11, and 62269 has 23, and that is an increase of 1. And keep in mind, if you didn't hear your zip code, that doesn't mean that there aren't COVID positive diagnoses in that zip code. What it means is it hasn't reached the level of 5 yet, at which point then we're able to report that particular zip code. So we'd just like to urge everyone to continue doing what you're doing. We've had 122 new cases since last Saturday, and it is a good sign that we're down from 6 to 5 on ventilators. But let's keep up the fight and just continue doing what we're doing. So thank you.
Well, at this time, as we said, on Sundays we try to do question and answers, and again we asked Brian Whitaker, our Assistant Director at EMA, to field those questions that you've sent in, and we want to thank everybody who took time to send in their questions, and we'll try to answer them the best we can. So Brian, thank you.
Okay. Director, we'll start with a question for you that came in. It says, with the warmer weather coming, people want to get out of their houses, and there needs to be more advertising to stay home. The writer says they're ready to make a poster and stand at busy intersections because people just aren't getting the message.
Well, and thank you for sending that in. And just so you know, we have about 15 of those lighted traffic signs that are throughout the county. Thanks to the cities of O'Fallon and Fairview Heights for the ones that they put up also. But the county also put them up, and we've got them throughout the county telling people to stay at home. We continue to do these daily updates, but we also need the viewers that watch this briefing every day to share our page, to get that word out to maybe somebody who isn't aware of what we're doing here daily. As the chairman says, we're all in this together, so helping spread that word will help get that word out, and maybe more people will understand just how serious this is. Thank you.
Thank you, sir. Chairman Kern, question for you is, while Governor Pritzker has said he's keeping an eye on the Metro East as an emerging hotspot in southern Illinois, many people have said that our numbers are nothing compared to Chicago and have called for the reopening of southern Illinois. What should be said to those people to help them understand why it's not yet safe to reopen our area?
So as we've said all along, this has to be, the response has to be guided by science and guided by the medical community. And right now, they are saying, let's stay in place, shelter in place, continue as we are right now. If you remember, we had a doctor on earlier this week who said that he thought last Sunday it appeared that St. Clair County had reached its peak. And then when he came to work on Friday, this past Friday, it just, everything broke loose, and all the patients started coming in again. The COVID-19 diagnoses spiked again, and we saw a lot of new patients check into the hospital. We saw deaths double since last weekend. So it's clear we're not through this yet. If we would release and go back to the way we were too early, all we're going to do is prolong all of this agony. What we need to do is just stay in place, let the medical community guide us. They're looking at these numbers every day. They'll be able to tell us when it's time to go back to normal, or at least what the new normal is.
Thank you, sir. An additional question here for you. While keeping an eye on the Illinois cases, do you feel it's also important for our area to specifically monitor St. Louis, since many St. Clair County residents work in Missouri?
I think absolutely. So we're all a region. I understand there's a river that the Mississippi Ocean separates the two of us, but we are all together. People work in Missouri, people shop, there are things that go on every day. Those contacts are made. So the good thing and the good news is that we continue to work with our Missouri counterparts, elected officials across the river, and the medical communities from both sides of the river in Illinois and Missouri continue to work together. Memorial Hospital is associated with BJC anyway. I mean, they are partners. BJC owns Memorial, so those operations are all really one anyway. So we are looking at this as a global issue. When you hear the response from the state of Illinois, it does not necessarily contemplate Missouri, but certainly our response does.
Okay, thank you. Sam, the next question will be for you, and it says, many seem to be confused about how deaths are counted as being from COVID-19. Once you have tested positive, is your death automatically attributed to that disease?
So once you have a COVID positive test result, what it does is it is considered one of the contributing causes of death. It isn't labeled COVID as a blanket statement. That is considered a contributing cause of death.
Okay, thank you. An additional question is, are you able to include the number of positive patients that do not require hospitalization?
So yes, so in the numbers that we reported to you just a few minutes ago, currently we have 287 COVID positive patients in St. Clair County. 71 of those are currently hospitalized. Unfortunately, 18 of those have died, and so that would leave the remainder of 198 patients that are COVID positive that are not hospitalized.
Okay, thank you very much. Director Simmons, this kind of goes to the governor's executive order, and it says, would it be okay to open clinics up that work with hospitals to their full schedules immediately?
I don't think the executive order clarifies that yet. The new one's going to be coming out. Right now, they're not able to, and we're kind of waiting to see if there's going to be any new executive orders that come out that would clarify that better.
Okay, thank you. Chairman Kern, as you've talked about working with the Metro East region and determining all this information, a question that's come in is, when do we believe St. Clair County or the Metro East will hit its peak?
So as we said, we had a doctor here earlier in the week. Sometimes we get these dates right. Sometimes things surprise us, and cases tend to rise again. The current prediction of a peak for this area, and that comes from the regional task force that involves Missouri and Illinois, is April 25th. That is the date that they're kind of eyeing towards. But those things can change. They can be days earlier or days later. And certainly, if we don't all stay and shelter in place and do what we're told, we could maybe reach a peak and then have a second peak. So April 25th is when we hope to reach the peak and maybe start to see some light at the end of the tunnel. But we got to continue to do what we're doing in order to get there.
Thank you, sir. Sam, we have a question that says, my husband was sick the end of March, beginning of April, but not sick enough to be tested. I have several underlying health conditions and want to know if he had it or not. Can we get the antibody testing in St. Clair County?
So with the antibody testing, there are a few things that I would like to point out with that test. It is available. Certain physicians are doing the antibody testing. The FDA has not reviewed or approved that as a method yet. And negative test results do not rule out the COVID infection. What it does is it simply says if you have had the COVID virus in the past or not. And it does recommend following up with the second diagnostic tests to rule out the infection. And it also says positive test results may be due to, as I said, a past or present infection of the virus. And this antibody serum testing should not be the only tool utilized to test for this virus. So, while it is good to be able to have the ability to test with the serum testing and to say, yes, you've had it in the past or not, the FDA is still saying that they recommend a second source to confirm the positive or negative test result. And please keep in mind that that does not mean that you are positive or negative at the time. It's positive or negative in the past.
Okay, thank you. An additional question for you is, what is the process like of being screened for COVID-19?
Okay, so first of all, we would recommend that you call your primary care provider. And if you do not have a primary care provider, there are several urgent cares in the area that are taking phone calls if you do not have a primary care. And what they're going to do is they're going to go through symptoms with you. Do you have any fever, cough, shortness of breath, headaches, vomiting, diarrhea, any nasal congestion, any exposure to a known COVID positive patient? And depending on your answers, they will then take the next steps. So if you meet that criteria, some offices are testing in-house. They may test you right there, or they may send you to one of the testing sites that are around our area to have the test then performed. So there's several steps to the process, but the first is definitely calling your primary care provider. And if you don't have a primary care provider, following up with an urgent care close to you.
And one final question for you, Sam, that came in. And I believe you touched on this a little bit earlier, but just so we make sure we answer the question here. It says, why are we not reporting how many employees and staff are COVID positive at area nursing homes?
So I will repeat those numbers since that is something new that we've reported today. So the long-term care centers that are in outbreak status currently in St. Clair County, and that includes residents and or staff members with 2 or more at that facility, and that is 2 or more COVID positive test results and or symptoms, are Berea of Belleville. They have 11 positive cases and 1 death. Colonnade of O'Fallon, which has 2 positive cases and no deaths. Four Fountains, which has 8 positive cases and 1 death. And Memorial Care Center, which has 13 positive cases and 1 death.
And Sam, I think it's worth mentioning that those are numbers that they've just authorized us to start releasing.
That is correct. The state today just put those out on their website for the first time, and so now we are bringing you those numbers from here on out.
Thank you.
Director Simmons, we have a question here that says, people in our town and neighborhood, to include entire groups of adults, continue to gather, hang around their house, have social gatherings where they're all outside drinking beer and riding ATVs. What should we do?
Call your local authorities, as we report it each week when we have our conference calls with the local mayors and the police chiefs, which I continue to say have been very supportive of this whole situation. The calls that we get in our 911 centers are processed just as normal calls, and they get relayed to those authorities. In fact, we had one last night in the Cahokia area. We received several calls on, and it got addressed immediately. So I would recommend that whatever town you're living in, notify the local authorities and let them know your concern. And if you're not getting a response, then call the EMA office here, and we'll get to the bottom of it for you.
Okay, thank you. We have a couple questions that came in about the schools, and we're glad to have the St. Clair County Superintendent of Schools, Susan Sarfati, join us here again today. Ms. Sarfati, the first question is, when will the actual school year end?
Well, that's going to vary from district to district. As you know, all of our schools are required to have 180 total student attendance days in addition to parent-teacher conference days. And our schools start on a different day, and so they end on a different day. Different schools have had different numbers of snow days. So the news from Governor Pritzker to end the on-site learning and continue with remote learning through the end of the school year came late on Friday afternoon. So as this coming week progresses, our superintendents are going to be forming up what the last day of schools will be for each district, and they will notify parents either through an email blast, a phone robocall. It'll be on their school website, so parents should be watching for notification from their local school district.
And that kind of goes into the second question that came in about schools, and it says, how will schools handle end-of-year events such as pickup of student materials or anything that remains at the school?
Well, it'd be picking up of materials that the students may have left at school, and also returning of materials that maybe went home with the children, whether it be Chromebooks or iPads. Maybe some students went home with textbooks that will need to be returned. All those pieces of information will come from the individual school superintendent or school principal.
Okay, thank you. Chairman Kern, another one that's come in, as you talked about the peak possibly being late April, as has been discussed with our partners here in the area. It says, if we do peak in late April, does that mean we would open things up automatically, or would there still be an additional time frame after that peak before we start seeing some progress towards reopening of things that are currently restricted?
So, as I said before, it is all based on science. This can't be done in a piecemeal fashion just because things look better in St. Clair County. We have to also look at Madison, Monroe, Randolph, really the entire region, St. Louis County. If we start doing things on a piecemeal basis, it's the wrong way to go. We've got to act in a statewide basis. At least large portions of the state that are seeing the same diagnostics perhaps can act together, but let's leave that to the medical professionals. Let's leave that to the scientists to tell us it's safe now to move forward. Here's the way that you open up. It isn't all going to go from 0 to 60 in a day. You're going to have to open up slowly on certain things to make this so that we don't have a boomerang come back and hit us in the head and have us all regret that we opened up too early. I would also want to say a couple other things. That someone asked a question about people gathering. It's really imperative, and Susan Sarfati talked about the students that are out there. Parents need to get a hold of their children and their kids that many times are in adult status, and let them know it isn't just about them. A lot of young people feel invincible. It's about grandma who may be living with you. It's about someone who is immune compromised that may be in the household too. That just because they can go out and be with their friends and they don't have symptoms, or they can handle those symptoms, doesn't mean that the person that they're in the household with can. And so they are really responsible for bringing something into that house that is going to be deadly to people that live there. So the students, the kids, need to realize that they shouldn't be gathering. They should be sheltering in place. It's boring for many, and it's not what they want to do, but it certainly is something that everybody must do. We also got a question about, is it possible to get a visual aid on bending the curve? You can't really look at the curve necessarily as just St. Clair County, and our numbers here are pretty much St. Clair County centric. When you have regional numbers, you're able to better tell where that curve is and how it's bending. It's clear that it isn't just the positive testing anymore that is going to really give us a realistic curve. I think it's really the COVID positives that are hospitalized. That's the relevant number. Those are the things that we need to look at. And when those hospitalizations start to go down, ICU numbers go down, even ventilators. We heard earlier in the week from our emergency room doctor told us that they're using other methods other than ventilators to try to help people that are in ICU with COVID-19. So everybody's learning during this process. Those visual aids are good when they include all the numbers in the region, and so you won't see that chart here. What you're going to hear here is what the expected curve date is, and then you're going to hear specifics about St. Clair County with the numbers that Sam drills down on every day, that she collects from all our hospitals and all our testing sites, and make sure that you get the most up-to-date information at 3:30 every day that we could possibly give.
Chairman, I want to just piggyback on that. Yesterday with our young lady Peyton, I think she really drove that message home. If anything, we need more students like that. It's following her advice. I mean, she was really coming from the heart with that little visit she made with us here. So we want to thank Peyton once again for coming in with that story.
And you heard on the news last night, the bus driver from District 201, his widow was on the news.
Yeah, if any of you didn't see that on Channel 5 News, go on their website. The bus driver from 201 that passed away, they did an exclusive interview with his wife. And, I mean, if that doesn't hit home, I don't know what to tell you. I mean, take a look at that. And for those of you who think that we're overreacting and the media is overreacting and what we're doing is overreacting, just listen to that lady that 5 days after her husband was entered in the hospital, she's planning his funeral. Sad.
Sad.
Okay, thank you. Sam, I want to come back to you with a couple follow-up questions that have come in through the feed today. The first one being, how were tests given? Everyone that I know is being told they're positive, but hasn't actually received a true test.
So as we have said in the past, not everyone will be tested. If you are mildly symptomatic, the suggestion is to assume that you have COVID and that you are COVID positive, and we are saving those tests for those that are significantly ill and or hospitalized. But hopefully we will be getting more tests to the area soon. But that is the situation. If you went to your doctor and your symptoms were only mild, what they probably sent you home with was assume that you are positive and take the necessary precautions, which would include sheltering in place, which you should have been doing already, but also socially distancing from those if you have anybody in your house with you, making sure that you're staying away from them so you don't pass that along to them.
And Sam, the reason for the testing in the hospital of people who are actually in serious condition, the hospital is so that the medical professionals know that they're treating the right
patients.
illness.
That is correct.
That maybe the symptoms might be the same as something else, but they want to make sure that when they're treating for COVID-19, that's what that patient has.
You're exactly right. And with COVID-19, it is so difficult because so many of the symptoms, are similar to what the flu is. And, we had this time of year, a lot of flu going around. So you've got the nausea, the vomiting, the cough, the fever. So by doing the actual test and ruling out COVID, they're able to treat more effectively.
And I don't want to be misleading too, Sam. Our numbers only reflect those that have tested positive for the COVID. If they've been presented themselves to an ER or to their healthcare provider and they don't test them and say, assume that you are, those numbers aren't added in.
That is correct. Unless you have actually been swabbed and have a true negative or positive test result, if you have been sent home, as Director Simmons said, that you should assume you are positive, we do not count those within our numbers that we present to you every day.
But with the new Southern Illinois Healthcare Foundation testing sites, the 3 new ones that are opening up this week, we expect to see many more positive.
We do. And as we increase the amount of tests, it is only logical that the increase in the amount of positives will go up as well.
Thank you.
One of the questions, Sam, we get a lot is about the numbers, and a question has come up on the thread today. Why is the state website showing Memorial Care Center at 54 confirmed cases, but what you announced was 13?
So we saw that as well, and we actually clarified that with Memorial, an employee with their administration. We did clarify those numbers beforehand, and the number that we presented, 13, is accurate, and that was confirmed by Memorial Hospital.
So as the state disclaims on their website, numbers are provisional.
Yes.
They're tracking things throughout the state. So
That is correct.
And as the chairman reported earlier, through your hard work every day, we are reporting the up-to-the-minute numbers that have been
Correct.
developed in St. Clair County as of the time of this briefing each day.
And the numbers that we bring to you, we are in touch with the hospitals multiple times a day. So, the numbers that we are getting are straight from the hospitals, straight from the staff that are working with those patients and are the most familiar with those numbers.
And in defense of the state, there are 102 counties in the state
It's a
of
lot to
Illinois.
juggle.
So they've got a lot of numbers coming in, and mistakes are going to happen. As long as everything's owned up to and those are corrected, that's the bottom line.
Absolutely. And we got one final question that came in for Director Simmons. How are the agencies throughout the county, police, fire, EMS, how have they been affected by COVID-19?
Well, as we've heard, we had Chief Johnson from Swansea Police Department on this past week. One of his officers was diagnosed with it and is doing well from the report that the chief gave us. We have knowledge of another police officer from the East Cronlet Police Department that was diagnosed, went through his quarantine, and got cleared. So it is affecting. I mean, we know of a couple of EMS workers that were tested. We know we have a friend, the chairman and I do, that had a member of their family pass away. I personally, one of my family members was diagnosed with it, and has went through 17 days of quarantine. And it's one of the hardest things to do is to sit here every day and ask people to stay home, and knowing that you have a family member that the walls are closing in on them, and all you can do is call them on the phone. And I find myself calling them about 20 times a day, checking on them, because when you read all of the symptoms, the shortness of breath, every time I would call, I would ask that question. So it does hit home, and maybe that's what it takes for you, the naysayers, for it to hit home, because it's not a pleasure to sit there and worry about a loved one. So yeah, it's out there, and it has affected the first responders. And if we don't practice social distancing, if we don't stay home, the odds are some of us may not stay alive. So if there's no more questions, Brian, I think that's a wrap for the day. We'll be back here. We've got some medical physicians that will be joining us this coming week. I know the CEO of St. Elizabeth's Hospital is going to join us one day. So we're going to be here until the need is no longer. So we'll be back in just a few moments with Cindy, who will be translating this into our Spanish communities, and try to have a good rest of the day. Thank you.